Welcome to this special conversation on health insurance, where we bust several myths and where women are actually taking charge, taking the lead, not just for themselves but also for their families. My conversation today is with Supriya Rathi, who is the whole-time director and principal officer at Anand Rathi, and among all the other profiles, all the other job descriptions, she is the woman who spearheads the insurance vertical at Anand Rathi. Supriya, it's a pleasure to have you on this conversation. First things first, I want to know a little more about yourself, because the Anand Rathi Group obviously is, a well-known name in financial services. How did you get down to picking insurance as your area of expertise?
Thank you first and foremost for having me. It's a real pleasure to be here. Well, actually the timing kind of fit right, and as you said, we're a group of financial services, so we offer the entire breadth of financial services. Around 2003, when the sector opened up, insurance broking licenses were available, and we saw it as a great synergy with the rest of our financial planning, and which is where we started out. And I wanted to actually start something new when I got into the family business. Okay. And so that opportunity came up, and then there's been no looking back. It's been a great journey, lots of learning.
You know, this is so inspiring, because here we have a lady who's not just a business leader, but she's in insurance. So it's not rocket science. Women, we can really do this and learn from Supriya. Who better than her to tell us that? Before we start, getting into more details, I just want to get a broad sense from you, because the last 11-12 years that you've seen the insurance landscape in India, what would you say is the most poignant trend that stands out over the last decade?
With privatization, the awareness has picked up to another level. As you're aware, Social Security doesn't really take care of too much of health insurance. So a large part of the medical expenses that are incurred have to be borne by the families themselves, and there's really no cover either from the government or sometimes even the corporates. So health insurance in the last few years has seen accelerated growth of over 20% each and every year, which is great. Sometimes working capital or your entire cash flows, budgeting just goes for a toss.
Yeah, absolutely.
And you see families come down under, especially if there's a single learning member in the family, and you don't know how much health insurance you have, or you don't have any. It can just put everything as a big spoiler.
Absolutely.
So that's one trend, I guess, awareness, but we've got a long way to go. And with Ayushman and a lot of government schemes, of course, the government is doing its own bit.
Sure.
And these are good trends, but we're still far from where the developed world is.
Oh, absolutely, absolutely. Which is why I think conversations like these are really important. Now, here's a question. Though, of course, at your end, you do a lot of group insurance, group covers, but when it comes to personal insurance policies, have you at all seen at least a rise in women policy buyers when it comes to health insurance, or has that been that constant static number where it's just men taking the decisions?
Traditionally, financial planning and insurance is seen as an integral part of financial planning, has been done by the principal earner, which was earlier the man, but now despite women coming into the workforce in large numbers, that bit is still taken care of the men. And they, women go and they hand over their, monthly earnings and paychecks, and then they have absolutely no idea. So they've just, allocated that job to men.
You've hit the nail on the head, and this is where my next question comes in. Women are taking charge of their fitness. They're taking charge of eating right and following, great diets, and, doing the next best exercising fad that's hit down. While all of that is on the rise, that awareness is on the rise, why is it that women are not taking charge of health insurance and overall the financial well-being? How does one break this logjam?
It's about financial literacy, that women have never paid attention to it. And I think as corporates, HR needs to inculcate that financial literacy at that level. And I've seen this happen in close proximity, where the man has an insurance, but the women actually have no idea where those insurance policies are. And, if there is an eventuality, sometimes they don't even know which door to knock. And that becomes a problem. So I would go, one step forward and say it should be embedded into the curriculum. Absolutely. It's a primary need now.
So what advice would you give to women who are watching this program across age groups to at least get them to start thinking? what kind of health insurance products should they be looking out for? What are the conversations they need to have with their advisors, with their family members on health insurance?
Corporate plans are at best a starting point. So it's one checkbox, but you have to completely go out and assess what does it cover. So how much cover do you have? Is it in tandem with your lifestyle? You know, is it going to be adequate? So you've got a 1 lakh or a 2 lakh cover, is it going to be adequate? Then there are a lot of good plans available now in the market, which are like the critical illness program. So in case you develop a critical illness, you get a huge sum of money which will take care of your medical expenses towards that illness. So one is looking at a family floater plan where you've got your family covered, including your children as well as your parents. Rebalancing it and looking at it periodically to see if it's you know enough or not, and then a critical illness plan.
Okay, so ladies, please do keep that in mind. Now, since it's budget season, we have to ask you this one question: is there a wish list that you have for health insurance from the finance minister?
Absolutely. So, you know, I think what comes to top of mind is that in the last 5 years, the ATD limit has not been revised. It's still at 25,000 for a family, which I feel is too low because health insurance costs are rising, medical costs are rising. So looking at that, we're really looking forward to an increase in that deduction, which again will induce people to take larger and more appropriate covers for their families. And then of course on the GST, which is at 18%, so we're looking at a lowering or removing of that. Yes, absolutely. Yes.
So last and most important question, what is your own personal fitness and health tip? How do you manage to keep looking radiant, young and smart as always?
It's a conditioning, but one thing is that you know, we're all into an exercise regime at least 3 or 4 times. Simple things from walking or swimming or whatever it is that we like. So everyone follows that, and then simple home food. Rich with vegetables and fruits. I think it needs to be simple so that it can be consistent, and that really is you know, the mantra.
I couldn't agree more. The question is doing it. So while I get down to the execution of that, thank you very much, Supriya, for joining in and sharing these nuggets and these thoughts and this little bit of wisdom with us today. Thank you very much.
Thank you so much, Surbhi. Thank you.